Hello, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You are watching Health Links Aging Strong, which is Tufts Medical Center's injury prevention outreach. And it's a program that is aimed to share information that can empower older adults. And this program is sponsored by the City Health Department, the Quincy City Health Department. And today the topic is Social Security. And before I introduce my guest speaker, I read this very quickly on the internet, of course, in the Social Security .gov. And it says that the Social Security Act was signed into law by President Roosevelt in August 14, 1935. And it's designed mainly to pay retired workers up to 65 and older a continuing income after retirement. And so today's guest speaker is Sabrina Feliciano of the Social Security Administration, and she is the Public Affairs Specialist. Sabrina, welcome.
Thank you. Thank you for having me today.
Oh,
that is correct. Social Security was established then, and it was to help the workers.
Yeah, it's very interesting how, it feels like it's been around forever. Because ever since growing up, I hear people talking about Social Security and retirement. And then as I've become older, people are saying, okay, by the time it's your turn to retire, there may not be any left. So it's becoming, before it seemed like a security blanket, right, after retirement, but now it's becoming, a source of concern. So I'd love to share you and your knowledge to the public, because I heard you present before, and I couldn't believe how much information you were able to share in such a short amount of time. And I want more people to learn what you have to share. So let me just put on the share screen.
I'm here to talk about Social Security today. I'm very happy to be here. We've had a few conversations, and everything is definitely been so positive about this program. So I'm going to go ahead today and talk a little bit about Social Security and do some general information on our programs. And then hopefully this will be ongoing and we can talk about some other topics, but we'll do some general information today. This here, Social Security with you through life's journey, is sort of like our branding. We're here when you are born, we collect your Social Security number and your name. Then as you work throughout your history, we collect your earnings. When you are ready for retirement, we have retirement benefits. We pay spouses, children. If you should pass away, we pay survivors benefits. And if the unfortunate should happen, we pay disability benefits. So we say we're with you through your life's journey. Most popular baby names, it's funny, it's actually our most coveted part of our internet website, more so than the cost of living increase. So people are very interested to see how popular their baby name is and where it lands on the list nationwide, regionally. It's actually on the Today Show every year, very popular. So any given time you can log on and see where your baby name lands, what are the top baby names in your area. But just a tip, in popular culture, so a celebrity names their baby, does go to the top of the list. Social Security numbers and cards are now available online. This is very important because during COVID, we were not open to the public, and it was very difficult for people to get very important information and documents. So we have now put them online. Most of them can be done completely online. Those that need more information, it will actually make you an appointment, request either come in or see somebody at a certain time, and we're actually moving into video interviewing soon. Social Security is servicing about 64 million people. This large part of the pie here, the blue pie, does belong to survivors and disabilities. Then we have the green part of the pie, more disability, just the SSI portion, and then some people receive both. But the largest part of the pie are beneficiaries who are receiving retirement, survivors, and disability. So those are the people that put into Social Security and who are now receiving benefits from it. Who's paying for Social Security right now? Anybody who's working and their employer. So it's up to the current people now. Anybody who is receiving employee benefits. So anybody who's getting Social Security taken out of their check, they're putting in a portion, and then their employer is matching the other portion of that. So the current employees and employers. So one of the things that was mentioned is the Social Security, the trust fund, and how secure we are. We're in the hot seat. Of course, we have been for a little while. Funding and the trust fund is always sort of a hot topic. So the reason for that, if I can just explain, is back in the 50s and 60s, we had this large spike in the birth rate, better known as our baby boomers. Well, our baby boomers are ready to retire, which means that they are no longer putting into Social Security, but they are receiving. So a large spike in people who were once working and putting into the system are now off of the rolls and now starting to receive the benefit. Next screen. One of the other factors is life expectancy has changed. People are living longer. This is a wonderful thing. However, for Social Security, it means that people who were once receiving 12, 15 years are now receiving 15, 20, 25 years. So we have less people putting in, more people receiving for a longer period of time. Next screen. So altogether, it makes a little recipe for some issues. Now, Social Security was never meant to be the be all and end of retirement income. Social Security was supposed to be like a stepping stool to that, along with pensions that you receive from the employer, any savings and investments, which are becoming very important, and any other income. Some people like VA benefits, widows benefits, all together retirement income. Social Security being the foundation of that, because it's the only ones that are going to more than likely continue to increase with the cost of living throughout its history. So what does the final answer right now? Social Security is secure until the year 2035. We've been on the brink of exhaustion for many years now, but we continue to pay out. It's been 80 plus years that we continue to pay without stopping. Now, if Congress just says, well, we don't care about Social Security anymore, or the 64 million people that are receiving it, we're just going to ignore it, then the worst case scenario would be in 2035. It wouldn't just go away, but we'd only be able to pay 80 cents for every dollar that we're paying now. Again, that's the worst case scenario. If Congress just decides to forget about Social Security, and the year 2035 will drop down to 80%. But again, as you'll see throughout the presentation, Congress has already made adjustments this year to extend the trust fund, and we are confident that they will continue to do so. If you are interested in finding ways to earn, grow, best ways to spend your Social Security monies, we have a website called mymoney.gov. It is not through Social Security, but it is a government website, and you can find ideas on how to invest, borrow, and so forth. The mymoney.gov is the website, and 1-800-FED-INFO is the phone number.
Are a lot of people using this website?
So a lot of people actually enjoy a lot of the ideas, and they most feel safe because it is a government website. So it's not sort of funded by anybody. How do you qualify for retirement benefits? Earn what we call credit. They used to be more commonly known as quarters of coverage, but now we call them credits. So every year they put out the figure as to what each credit is worth. This year, 23, it's $1,640 for one credit. You can earn up to 4 credits a year. You need 40 total to qualify for retirement benefits. So they say about 10 years of 4 credits a year. 10 years will give you your 4 credits. Now, once you've earned them, even if you stop working, even if you stop putting into Social Security, those credits will be there for you when you're ready to retire. We do keep them, and we keep track of them. How do we determine your benefit? This is a very simplified version of the formula. But what they do, so that you get the gist, is they take the highest 35 years. So they look at your earnings record and they take the highest 35. Now, if you don't have 35 years, or if you have some very low years, what they do is inflate them to show that you had made at least a minimum poverty level for that year. So they look at your earnings record, they take the highest 35, they inflate the ones that they need to, and that's how they come up with your average index monthly earnings. Now, if you wanted to do this out in detail, you're welcome to do so. The link is at the bottom of the PowerPoint. And I would set aside quite a bit of time. It's a lot of math, a lot of formulas, and you will need your earnings record, but you are welcome to do your own formula out yourself. Full retirement age is one of the things that Congress has updated quite a few times in order to the trust fund. This is the most chart. It hasn't been for a few years now. I have it changing in the future, but it goes by the year you were born. So depending on the year you were born, that's your full retirement age. So if you're in 1959, your full retirement age is the first day when you turn 6 and 10 months. So if you turned it in July, then it would be July 1st. That's your retirement age. If you were born 1960 and later, it's 67. Full retirement age is when you can collect 100% of your benefit. Anytime you try to collect before that, you will receive a reduction. And we'll talk more about that. So when is the best time to receive your benefits? That is the magic question, but it's so different for everybody. It all depends on what your income is, who's helping you, who's living with you, what your life expectancy is, those kind of things. So what I can tell you though, is the earliest you can retire is age 62, and that would be 75% of your benefit. If you wait till full retirement age, that is 100% of your benefit. Some people wait even past that up to age 70, where you can get 130% of your benefit. So every month that you wait, it goes up dollar difference. And in this example, they gave a nice round figure of $2,000 as the full retirement age rate for this individual. If they started at 62, they'd get $1,400 a month. If they waited to their full retirement age, which is 67 for them, it would be $2,000. And if they waited till age 70, they'd get $2,480. So it all depends on when you retire. Full retirement age is 100%. And then anytime you wait after that, it goes up. Anytime you retire early, there is a reduction.
Do people get taxed on their Social Security money?
They absolutely do, yes. So anytime that people are receiving more than Social Security, they're more than likely going to be taxed.
Mm-hmm. And is it the same tax that everybody has to pay, or is it a little bit less because it's coming out of the Social Security check?
So you're taxed on what they call your combined income. So it includes half of your Social Security and whatever else that you're receiving. You can also work and receive your Social Security benefits. So if you're under full retirement age and you're working, you can make $21,240 this year, because these change every year. We'll take $1 for every $2 you make over. Once you reach the year of your full retirement age, so January till the month that you turn full retirement age, you can make $56,520. We'll take $1 for every $3 you make over. Once you're in the month of your full retirement age, we don't care what you make. You can make all the money that you want, and there's no limit to that. Social Security will not ask you about that. You may have to report to IRS for that, but not to Social Security. One of the things that Congress did to trust is they deemed filing law. And it states that anybody who was born January 2nd, 1954 and is deemed to file everything that they're eligible for. So it used to be some people could say, well, I'm full retirement. I would rather just start collecting houses now and move over to mine later when it increases. So they cut all of those loopholes out. Now, if you were born after January 2nd, 1954, you walk into the office or you file online, it's going to ask you to file for everything you're eligible for, you, your spouse, or anything else. Now, the only exception to that would be a widow's benefit. Voluntary suspension is the other one that they passed. It states that if you start to collect your benefits and your spouse or your child get on the record as well, and then you decide to go back to work, we will suspend your benefit. It used to be that only you were suspended, and your spouse and your child would continue to collect on your record. With the voluntary suspension law, if you're suspended on your benefit, everyone else is suspended as well. The only one that does not include is a divorced spouse, because they are a separate household. So let's talk about spouses. Spouses are eligible for 50% of the unreduced workers benefit. So if I'm collecting $1,000, my spouse at full retirement age would be eligible for $500. Now, if my spouse retires early, they will receive a reduction in that. And if my spouse's own benefit is higher than that half of mine, they will collect their own. It's not both. It's either or, and we always pay the higher of the two. So they'll look at what 50% of mine is and what theirs is, and they will give the higher of the two. If they collect 50%, it doesn't matter. It's still not going to affect me. I'm still going to receive my 1,000, and they would receive their 500. So spouses start at 50% of the unreduced workers benefit. And from there, if they retire early or if their own is higher, they will decide which one is better. We also pay divorced spouses, same criteria, 50% of the benefit. You had to have been married at least 10 years. You have to be unmarried. You have to be 62 and your ex has to be at least 62. But if you fall under all those criterias, then you can collect divorced spouses benefit. It'd be 50% unreduced workers benefit at full retirement age. And if your own is higher, then you would move on to your own. Now, the difference between a current spouse and an ex-spouse, a current spouse has to wait until their person retires and starts collecting Social Security. An ex-spouse does not have to wait. They can start collecting on your record even before you do. We also pay survivor's benefit. So if you should pass away, your widow or widower is eligible for 100% of your unreduced benefit. So if you should pass away, your widow or widower can collect 100% if they file at full retirement age. Widows and widowers are special because they can start as early as age 50 if they're disabled, age 60 as a regular retiree. That's about 71.5% of the benefit. They can go at full retirement age and get 100%. And widows and widowers are special in that they can actually move back and forth as it's beneficial to them. So I can say, well, at age 60, because my spouse passed away, I'm going to need to collect their benefit right now at 71.5%. And then when I turn full retirement age, I can move over to my own at 100%. So they can move back and forth.
It's one or the other, not both.
Correct. Always the higher of the two. So with the spouse's benefits, because they have all these options, you can take it at age 60 or 62, move to your own. That's the only one that you can't do online. So we will do an application with you either on the phone. Right now, the phone is the only option because we're not doing in-person interviews, but they will explain everything. They will tell you your different options, let you know what your break-even point is, and then ultimately it's your decision. We also offer survivor's benefits to children. If they're under age 18 and unmarried, they can collect on your record. If they're still in high school, they can collect till 19 and 2 months. We also offer disabled children benefits. So if they're deemed disabled through Social Security prior to their 22nd birthday, they can collect on your record throughout their adult life. Again, this will not interfere with your benefit at all. And just to recap, we also have widows and widowers that can collect at age 60, age 50 if they're disabled. And just a note, as a widow or widower, if you remarry after age 60, you can still collect on your deceased spouse's benefit. We also have a lump sum death payment. Now, this hasn't been updated since the 70s. So if your spouse should pass away, you or your child can collect a $255 one-time payment. We have parents' benefits. So if your child should pass away and you can prove that they were supplying at least one half support, we can pay parents' benefits at age 62.
Can you explain the lump sum death payments? What is that to help with the funeral costs?
That's correct. But again, it hasn't been updated since the 70s. So it's a one-time $255 payment. And yes, it was meant to sort of help with costs for that, but it really needs to be looked at, and they are looking at it. So to recap, spouses can start at age 62. Survivors at age 60, if they're disabled, 50. Spouses, you're starting with 50% of the unreduced workers benefit at full retirement. And widows and widowers at age 60 can get 71.5% and at full retirement age, 100%. Advanced designation of representative pay is something that came about just late last year, but it's become very important. So if you have your own account with Social Security, you can designate a representative payee for yourself. Now, it doesn't seem like it's something many people would feel they need, but we found that during COVID, people were being hospitalized and people were unexpectedly passing away. And we had nobody to contact. These were healthy, younger people. And so we had to suspend their benefit, which means that it suspends your health insurance if you get it through Social Security as well. So it was hard decisions, but we came up with this and it's been working very well. So if you go into your own account, you designate somebody. If something should happen to you, we could reach out to them and they should be able to contact you or help with your benefits. The tax question. So these are the actual thresholds. If you are filing on your own or if you're filing jointly, if you fall within these brackets, then you will be taxed. Now, details on this, you actually would go to IRS website, but these are the charts. If you're in these thresholds, then you will be taxed on your Social Security. And I believe the next screen shows the actual formula. So they use your adjusted gross income, your non-taxable interest, and half of your Social Security. And that's what they consider your combined income. So, and if you have more questions on the taxes, you can go to irs.gov. That's the publication there. You can actually pre-tax your retirement benefits as well. It's pretty easy. They'll ask you that question when you file. Medicare is the health insurance that they offer for retirees at age 65. You can also get it as a disabled person after 24 months of a disability. They are separate from us. We go hand in hand. We do their enrollments and their billing, but the actual Medicare information, you would call 1-800-MEDICARE, medicare.gov if you're online, and you can actually make your own Medicare account if you're interested.
And everybody who turns 65 should have an account? Is that what you're suggesting, or?
Yes. So if you are getting on Medicare at 65, you should definitely have an account. It will tell you all your deductibles, very much like a lot of the private insurances now where you can get online and see all of your claims, your visits, and all of that good stuff. So this is what their website sort of looks like. You can sign up for anything there. You can look for more coverage. You can check out a lot of Medicare is now outsourced. You can look at some of the other insurances and compare. But most importantly, if you have Medicare, you can print your Medicare card right from here. How do you apply with us for benefits? For retirement, spouse, disability, Medicare, you can go online. That's probably the fastest right now. I know not everybody enjoys online services, but they've really beefed these up. They've really paid a lot of attention to them. They've made them a lot more user-friendly. We compare to Amazon, so that's a good thing. You can also schedule a phone appointment. That's the number there, 1-800-772-1213. At the moment, we're not scheduling in-office appointments. We are still working as a hybrid, which means half the staff is in the office and half is at home, just to not crowd the office as we still have space in between everyone. So we don't take in-office appointments, walk-ins or those sort of things, but you can do all of the appointments on the phone.
Are you finding that a lot of people are using the online feature to apply? Oh, that's good.
Yes. And it's great because, we now have internet sort of like units. So once you submit it, we are mandated to review it, make sure you applied for everything you're supposed to, make sure that you didn't miss anything or make any errors. We have a 95% callback rate where somebody will call you and say, your first check will be this day and this time, or let's go over a few things.
That's great. And is it a very quick turnaround time, or does the person need to wait a week or 2 weeks in order to make sure everything was processed?
It's about a 2-week process, but that goes for even the face-to-face appointments. We still need a 2-week sort of like turnover time. So this is our new website. It's gotten a facelift just recently. It's got new colors and everything is supposed to be much more user-friendly. I have received quite a few compliments on it, not that I put it together, but that people are enjoying using it more. They tend to find things easier. It's right front and center. You can either prepare and get information, apply, make your account, or get your Social Security card.
Great. It looks like at the top you could switch to a Spanish version, right?
We can actually, we have about 17 different languages, so it's pretty good. We've got a bunch of online calculators. These calculators are getting better and better. Now, if you use the regular ones online, they're general, but if you make your own account, these calculators go into great detail on you, your spouse. If you wanted to put them in, they have flow charts, they compare. But if you wanted to just get online and use the regular general calculators, those people who are government employees, there's a lot of calculators for them on some of the legislations that are out. You can even, find out what your life expectancy is if you really wanted to.
Wow. Now, a question. If somebody they want to apply and they're just very nervous and even talking on the phone, very overwhelmed and nervous about what to ask, when to ask, what type of information. Who would a person seek to help them be able to apply for Social Security? Would it be somebody from a council of aging? Would it be an accountant? Would it be a lawyer? Who would they seek to help them just kind of have somebody just take care of it for them?
Well, if it's a financial planning sort of thing, I know that there is a lot of financial planners out there that will help. Now, I know that they're also costly. Shine representatives help with health insurance. And then the senior centers also have sort of like a money management team. Many of them, most of the bigger ones do, that you can ask questions to. I'm not sure if they would actually accompany you, but I always suggest that prior to your appointment, you have an idea of where you're going. So you have an idea of when you're going to retire. You have an idea of how long you're going to work, what your other incomes are, those kind of things. So you want to sit and talk to people prior to, and then use our calculators to see where your money peaks, and then be ready with those dates when you're ready to apply.
So does it help somebody who is just turning 60 to start really educating themselves on the lingo, the calculators, the benefits, just what to expect?
Absolutely. 60, we actually are going to start sending out some fact sheets, and I think we'll talk about them in a little bit, but they're more specific to age. So they'll start saying, like, at this age, from 40 to 50, this is what you should be doing. From 50 to 60, you should be here, and this is what you should know. So those kind of things. So for every age, I mean, especially age 60, you're very close to retirement. A lot of things like health insurance, you want to think about those kind of things. You want to think about, longevity, how long you want to stay at your job. And then, of course, how much it would cost to sustain the lifestyle that you want to live.
That's actually a big one, lifestyle that you want to live. Yes.
Right. It's not just paying bills. You want to have a certain lifestyle.
Fun. You want to have fun.
Yeah. And to travel, then, those are things you have to consider. So this is the My Social Security account. If you logged into our website, this is what you would see if you wanted to create your account. Very much like a lot of other accounts now, they're going to ask you certain questions, especially because of the privacy of all of them. They do gear their questions sort of through Experian. It doesn't hurt your credit, but they get information from there. They'll ask you questions like, when was your first car? Or is this something that belongs to you on your financial statement? Those kind of things. And then once they are secure that they know it's you, then you have your account. And once you have your account, you can pretty much do anything on there now. Get your Social Security card, get your Medicare information. You can print out your 1099, what you receive for benefits. If you had an overpayment, it would break it down for you. And if you're not on benefits, you can look at your earnings and your statement at any time. Now, this is really important because there are errors. IRS shares their information with us. And if there's an error, maybe they commingled you and your spouse, maybe they put a 0 year and you actually worked. You want to have that corrected right away. If you have proof of it, we can correct it, as opposed to waiting till you're ready to retire and we're scrambling for all of this information, because your benefit amount does count on your earnings.
Now, do you have to be a U.S. citizen to qualify for Social Security?
No, you can be a resident. You have to be a resident. So you can be, you don't have to be a citizen, but you have to be a resident.
A resident, okay. And then you'll be assigned your Social Security number.
Correct. These are just some of the things that I covered in my Social Security accounts. It would also tell you some people put into things that are not Social Security, separate pensions, private pensions, mostly the city, state, and government officials. They all put into private pensions. People who work for the city and state in Massachusetts, private pensions. So this, my Social Security account actually helps you find out how many credits you have. It will help you calculate how much you'll actually receive, because they are offset. People who put into separate pensions, we have to offset their Social Security. These are the statements. They stopped going out for quite some time. They were a little expensive to send out, but they have put them in the budget for this year, backed by popular demand. Many people have been asking for them. So they got a new color scheme. They're red, white, and blue now. They have more information. They're a little easier to read. So if you get one in the mail, don't be alarmed. They are starting to send them back out again. They're starting with the people who are closer to retirement, and then they're actually going the opposite way and sending it to people who just started their earnings history, and then they'll move in between. And these are the fact sheets that I was talking about. This one is for someone 49 to 60 years old. And then it talks a little bit about where you should be at, some of the things you should be looking at, how Social Security will impact you, those kind of things. So these should be going out with the statements, sort of like a supplement.
I love the idea of, knowing what to do when you reach a milestone in your age. Right.
So definitely listening. You're not the only one that has said that. So we've trying to accommodate those kind of things. Be a little less scary.
Yes.
Yeah, it can be definitely intimidating. I mean, this is your future. This is your income. And you definitely want to maximize everything. So it can be intimidating. And we're trying to do the best we can to put more information out there, because staff is, of course, limited, just like most places. We are on social media. So if anybody follows social media, Facebook, Twitter, Instagram, LinkedIn, YouTube. The YouTube videos have actually been very successful. They're a little cartoon-like, but they're very easy to follow and to understand. You pick the topic that you want, and it has a short video on how to achieve it.
Some questions for you. As far as the Social Security, are you finding that, and unfortunately, because a lot of the older population were affected by COVID, how has that changed as far as people collecting Social Security? Do you think the number has gone down a little bit, or do you think it's basically about the same?
So we did just have a call on sort of like the trust fund and how COVID has affected that. It was a large mortality rate during that time. It can affect a lot of things. As we mentioned before, less people putting in, but also jobs are a little different now. There's less people working, and this is not anything proven, but there is sort of like a sense of, enjoying life and maybe retiring sooner and getting all that kind of stuff going, because it can be short, So numbers wise, I don't have actual figures, but definitely COVID has affected the agency, the trust fund, just like all other agencies have been affected. Less people working, the mortality rate caused an effect. And because our trust funds are geared with people working and putting in, it has definitely affected.
Yeah. Can you talk a little bit about the trust fund? Is it invested in stock markets, or how does a trust fund gain the money besides people putting into it? And are the money that's being put in the trust fund, is that being invested so that way it also grows in another direction besides people putting into it? And how secure is it?
So we don't have a lot of information on how the trust fund is actually being monitored, sort of like that. We have the numbers on people putting in. We have the numbers on where it goes because there's different trust funds. We have the retirement trust fund, we have survivors, and we have disability. So we have the numbers on how that goes in and how it affects. I'm sure that there are higher people that have numbers on that other stuff that we discussed, that you asked about. But for right now, the monies that are taken out of the payroll, they go into Social Security half, the employer puts in the other half, and then the ones that are not collected actually goes into general government funds. So not just Social Security.
Oh, okay. All right. Interesting.
Mm-hmm.
Just so much to understand and so much information.
It is quite a bit.
You know what? Actually, one of the shockers is the slide that you had. It said a man turning 65 on April 1st, 2022 can expect to live on average until 84.1. Wow. Yeah. And then a woman, a little bit more. So a woman turning 65 on April 1st, 2022 can expect to live on average until 86.7. Wow.
It's surprising the numbers that we have. Like I said, like you can even calculate your life expectancy.
Yeah.
I mean, it's a good thing, I believe, but
it's a good thing. But the idea of, a lot of baby boomers, they were in the workforce, so they were really able to give a healthy supply of, funding into the Social Security. And now they're retiring or have retired. They're the ones that's using up what they put in. Mm-hmm. Pretty much.
Right.
Yeah.
So it's, because the way society has shifted, before we had more people putting in, I think, it's dropped down to about 2.6 workers for every person receiving benefits. It used to be higher, much higher. So, again, that's part of the reason why Congress is looking at the trust fund, why they have to make certain decisions, why they have to change certain things in order to keep the benefit continuing to run and to pay out. It's not, a lot of people don't enjoy the fact that full retirement age is moving further and further out, but we also have to adjust to society and what people are living further and further out. So
that's true. Yeah, I think about my mother who retired at 75 because she was told, "Okay, you're 75 now. It's time for you to retire."
Yeah, so forced onto it. Yeah, you have to. Yeah.
She was like, "What are you talking about? I love work."
Yeah.
And then I think about others who are like, "I can't wait to turn 65. 65 was the magic number, right? I can't wait to retire." And, they have all this preconception that, everything's going to be rosy and, they have all the freedom. But, the more I work with older adults and the older I'm getting, the more it seems like it behooves us as we're getting older to really have a plan to, know what we're going to be doing. And like you said, there are many different factors and how much how much our Social Security check would be. It's not when we retire, right? It's not just the age that we were born. The impact could also be the kind of work that we decide to do, because it depends on, the income. Okay. And that 35 year, you said 35 years, they look at the 35 years.
Highest.
Yeah. And they take the average. And then when you choose to start collecting, also is going to determine how much money you'll be getting, right?
Yes. And I think too, going back to what you were saying about your mom and her generation, I think all the generations sort of look at it differently. Actually, we actually have different sets of marketing based on our sort of like our audience. So if we do presentations even in the colleges where we talk about where your money is going, your earnings, and how it's all, and it's a different sort of marketing. I mean, for millennials, for Generation X, for baby boomers. So everybody looks at it a little differently. So you said your mother was, like ready to stay on board as long as she could. My father was very much like that too. He's actually still doing some work in schools as a professor. And I'm like, geez, like, when? But, they're happy doing that. And so then you said the other side of that, where they're just like, I cannot wait until I retirement age. I'm the first one. So.
Yeah. Now, that's very interesting. And I'm so glad to hear that you have different age groups that you're educating, the millennials and then the, different age groups. What are the typical questions that you would get from millennials when you do a presentation, such as, something similar like this? What's their concerns? What are their questions?
My experience, millennials are more geared towards like, how to maximize those funds, sort of like, maybe can I use these money and invest them in something else? Or the big, trust fund question, like where are we going with this and how are we improving it? That's those sort of questions. When I speak to people in the older crowds, it's more of like a security. They want to know, what are the guarantees that they have? How long are they going to receive this sort of benefit? So it is very different depending on who the audience is.
Interesting. Yeah. So you mentioned that if a couple became divorced, the divorced spouse can collect because it's considered under a different household, but it looks like they have to be married for at least 10 years.
Correct. So the criteria is 10-year duration of marriage. So, and the reason for spousal benefits, and they go both ways, if somebody stayed in the household to raise children or to care for the household and another one out to work, now that it's time to collect these benefits, the person that went out to work is going to have a higher benefit amount. So those spouses that stayed home are now eligible to collect half of that because they were doing the home stuff, the still working, but not putting into Social Security. So now if you were with somebody for 10 years and you stayed home and that person worked and now you separate from them, we have to protect those people and make sure that they get benefits because, it's not, what happened to those 10 years where they were working, just not putting into Social Security. Even if that person remarries, they still have eligibility if they can, meet out the other criteria.
Okay, that was my next question. Do they get, once they remarry, do they continue getting it? So you said they have to fit some sort of a criteria, right?
Right. So the number holder, if they remarry, then you can still collect divorced spouses benefits, but the actual divorced spouse should be unmarried because if they marry again, then their new husband or spouse or wife is the one that they'll collect on.
Okay. Wow.
It's a lot. It really is. I've been with the agency 22 years and still learning new things. Every component, there's all different components to Social Security. They have their, technical and specialties that I still go to people and say, hey, what about this? Or how is this changing? So it's ever changing. It is a government funded program. So as laws change and we do as well, we have to adjust.
Mm-hmm. So you said there were different trust buckets basically for the retirement for people who are disabled, right? And also for children?
Survivors, yeah.
Okay.
So, many times a person who is disabled and receiving Social Security disability benefits, they question, well, what happens when I turn full retirement age? It's actually very seamless because your disability rate and your full retirement age rate is the same. Once you turn, it just switches pots from the disability trust fund to the retirement survivor trust fund. So, right. It's just about pulling from the correct place.
Okay. And if a person is disabled, do they also have Medicare, or is it more Medicaid that they get, or is it both?
So it could be both, but once you are on Social Security disability for 24 months, you will be eligible for Medicare, regardless of your age. And Medicare is also at age 65. Now, prior to that, if you don't have a health insurance and you qualify, you can get Medicaid. I always say Medicare, we care. That's how and then, so the Medicaid sometimes will even, depending on your income threshold, pay the premium for Medicare. So many people have a combined sort of health insurance.
Wow. Wow. What's the data now as far as, people who are collecting, people who are disabled, how much are they collecting or how much of them, that population, are getting both Medicare and Medicaid? Would you happen to know?
I don't, because Medicaid is through the state, so they would have those numbers. So I don't have a comparison, and I don't really know how much the state is having people, how many people they have on. I will say that the majority of the people on retirement and they start off on a private and then they move over to Medicare after, because they maximize their private insurance until they can, and then they move over to the Medicare. And then some people, like state government officials, they go on Medicare and their private insurance throughout their history. Disabled beneficiaries, they have a lot of combination health insurance, Medicare and Medicaid. We even have some beneficiaries who are on other programs that we offer, because we talked today about disability retirement and Social Security beneficiaries, people who have worked and put into the benefit. We also have an SSI program, which you don't have to have worked as much or at all. And if you qualify, you'll receive that. And that comes hand in hand with Medicaid. So there's a lot of different programs and a lot of different combinations, actually.
Wow. So it's a lot of ways to really help support an individual, no matter where they are in life.
Right. And the SSI program also pays retirees. They pay disabled beneficiaries. It's more income driven and based. It's a very individual program, not like Social Security where you can have yourself, your child, your spouse. SSI is all individuals.
Wow. Wow. Now, what other programs besides the SSI that your organization offer for people who are, retiring or about to retire?
So right now we have the retirement benefits, survivors benefits. We also have for Medicare, we have A, B, C, and D, which is A is hospital, B is medical, C is private mixed with us, and then D is prescription drug care. We also have a Part D program where we can help pay like certain costs for Part D. So if you qualify, I think they pay up to $5,000 in drug care costs. We have the SSI program, which we don't offer the Medicaid, but if you qualify for SSI, you qualify for Medicaid. They go hand in hand. And through the SSI program, we can also link up with the state for food stamps. So if you qualify for SSI, more than likely we can send a message to the state and you'll qualify for food stamps.
Wow. Wow. Interesting. Wow.
For, we offer so many programs, but even with disability, we have wounded warrior programs for our vets. So with each program, they have something that, helps the individual.
Okay. And how can people find out more about that? They would go on the website?
Our website is probably the best wealth of information right now. It has everything. You can also call the 1-800 number. They are a national number. They're open 8 a.m. to 7 p.m. So I would try an off-peak hour, and they have a wealth of information as well.
You've shared a lot during our time here, and I really appreciate that. And I hope a lot more people are, gaining an understanding at least of, how they can kind of, take the best advantage of retirement through your presentation, which has been really awesome. What are some key takeaways do you want people to gain from your presentation, your talk today?
I think that preparing, readiness, you hear a lot of things that float out there. Definitely back it up with any formal information, like from our website, an employee, a 1-800 number, because there is a lot of misinformation out there, unfortunately. There's a lot of things that come in the mail that we did not send, or any agency that has anything to do with us. So fraud is a huge, huge deal right now. We are doing campaigns. We are trying everything to stop the fraud, but you knock one down and another one builds the next day. So be careful what you share over the phone, and make sure that you're talking to somebody official. We have on our website the Slam the Scam portion, which will give you ideas, tips, things. We do contact people, but we're not ever going to say if you don't pay this money right now, we're going to stop your benefits, sort of things, which a lot of people are sort of falling for. Just be careful and be prepared and be ready for your retirement, because once it's here, I hope that everybody enjoys it.
I know we've talked, and I'm gonna have you on again to talk about another topic in the near future. And definitely, fraud is something that I would love for you to talk about, because a lot, like you said, it's the perpetrators have become so smart, and they're become smarter, I should say. And it's really very important for the public to know how they can kind of really protect themselves.
Yes. Some of the stories that we hear are so unfortunate. They're so sad. And they definitely prey on very vulnerable people who, need the benefits that they're taking, people who have not encountered things like this before, someone on the phone asking you these type of questions. The topic of Social Security, anytime someone calls, can be a little nerve-wracking for anyone, because it's their benefits, it's their money. And so then when they're threatening, and, it's really awful. It's really awful. So I hope that, you be as careful as you can. At any point, calling the office and saying, I just want to verify that this person, that's not a problem. I mean, the wait is a little lengthy, but it may be worth it, definitely.
What's the rule of thumb as far as sharing your Social Security number? Is it okay to do it over the phone if you're applying for something? What is the tip as far as to keep people from knowing what your Social Security number is?
Well, if you're calling our agency, you're verified that you're calling our agency. There's no problem with sharing. We actually need your Social Security number to access your record. If we are calling you, we more than likely most always send you a letter ahead of time saying, we're going to call you on this time, this date. This is your appointment date. It will have all our information on there, phone numbers. So if you want to verify the employee or who they are, you can do that. If we do cold call, a lot of times our employees will say, if the person on the other line doesn't feel comfortable giving us information, call me back at this number and extension. It's the Social Security Administration. That way you can verify we do work for the agency, and it makes it a little easier. So, the rule of thumb is verify that you're talking to someone from the agency. Verify even online.
Very good to know. So if somebody lost, you talked about Social Security card. So if somebody lost their Social Security card, they can just go online, and you said they could just print it.
So it will come in the mail. They can print their receipt though.
Oh, okay.
They still make them, at the card centers and mail them out. It takes about 7 business days, but they can print out a receipt that they applied. And a lot of times that works for a lot of places. Not like passport or anything like that. You would have to wait for the actual card, but it'll come in about 7 to 10 business days, but that's the same amount of time as if you came into the office to apply.
Is there a cost to that to get a new card? No.
There should not be any cost to the card, and there should not be any cost for an application. You can print an application on our website for free. And if they're asking you for money to print one, then you're in the wrong place.
Oh, okay. Very good to know. Good to know. All right. So we are at the top of the hour here, pretty much. And I just want to thank you, Sabrina, for being on the program. And I learned so much from you. Once again, I saw you present before, and I was taking really a lot of notes then, and now I'm just so glad to kind of re-listen and to just kind of re-educate myself on some of the important topics and different ways to be able to prepare myself for retirement. So thank you for that, and I can't wait to have you back on to talk about other topics. And I want to thank the Quincy Health Department for their sponsorship of this program, Aging Strong, which is found under Health Links. So until next time, everybody, I want to thank you all and be safe and be well. Take care. Bye-bye.